Okay.
Good afternoon, everyone. Thanks very much. We had a great meeting with the Prime Minister. Obviously, we began the morning talking about the vaccine and its rollout. As many of you know, we had that conversation here with Dr. Strang. Our first doses are in next week. We'll get a better sense in the coming weeks of what the rollout will look like, and the numbers as they start coming. We'll get a better handle on numbers from the federal government. We were updated by the General as well as Public Health, Dr. Tans, which was a positive meeting, and out of that it came that the federal government will actually be paying for the vaccine to arrive here, and of course we as provinces will cover the cost of it, distribution, making sure that it ends up in the arms of Nova Scotians in the best way we can, using our healthcare system and our healthcare team to deliver that. And then we went on talking about the CHT, the Canada Health Transfer. The federal government acknowledged they needed to spend more money delivering that. There was much conversation on what that would look like, how that would happen. Obviously, there's different parts of that system, and each part of the country was viewed in their own way. But the premiers across this country are united that the federal government needs to play a more active role in financing the delivery of health care across Canada. The Prime Minister acknowledged that they need to do more, and now we're looking for an opportunity to see what that looks like, whether the investment is directly into long-term care, pharmacare, a national pharmacare program, what the way they want to do that, and that work will continue and be ongoing. So with that, I'll take any questions you may have.
Okay, thank you, Premier. We'll have one question, one follow-up in the time we have available. Mike Gorman at CBC, please go ahead.
Thanks, Premier. You sound relatively positive, I guess, coming out of this meeting. But that notwithstanding, do you have any sense that a change to the transfer would happen in the short term, or does it sound to you like this is still looking like an ongoing negotiation that'll extend beyond this year?
Well, I'm cautiously optimistic, I guess is probably the best way to put that. There's still a lot of work to do, but the acknowledgement was a positive one when we heard from the federal government. They recognized they needed to spend more, and now the conversation will be ongoing about where that'll happen. I believe it should be at a unified table. I believe all the provinces should be together, not in bilats. I think this should be a national conversation so that we can continue to get down to what we believe are the concerns of Canadians and do it in a way that's holistic across the country.
The last time that there was talk about money, of course, it was done bilaterally. I think, if I remember correctly, our deal had to do with extra money for long-term care and mental health. When you contrast that with what you're talking about now, why for you is it more important for everybody to be at the table for this conversation rather than for individual provinces and territories to work outside deals?
So the last time it was for home care and mental health, you're right. But, you know, and it's my view this conversation has to happen now. You know, everyone is pointing to the pandemic. Obviously, it's created great pressures on the fiscal capacity of provinces to deliver, but let's not kid ourselves. This conversation about delivery of health care was here long before the pandemic. There needs to be a national conversation about how do we deliver health care from coast to coast to coast and deliver it in the uniqueness of our respective jurisdictions. And I believe everyone needs to be at the table in order to do that. These bilats, while have worked at different times, this is something that will change the delivery of health care for decades. And I think it needs to be done as a nation, with the federal government playing an active role financially in the delivery of health care. We need to hear from them exactly what are their priorities, and they need to hear from all of us as regions what it is that we see and how do we deliver our system and deliver health care. And I was very clear on the call. I'm not opposed to have a targeting funding. If there's a priority that the national government, if it's long-term care as you just described, and they want to target funding to that, we're fine with that. If they want to target it towards a pharmacare program, we're fine with that. But the reality of it is that 22 cents on the dollar is not enough to continue for us to deliver health care in a way that I think Nova Scotians want. And quite frankly, as I listen to fellow premiers across the country, our situation is not unique. They want the federal government to play a more active role.
Okay, next we have Stuart Peddle from the Chronicle Herald. Go ahead, Stu.
Hi, my question is about the logistics of the vaccine rollout. Do you have an idea of the timeline and the province's role and how that's going to be delivered?
Yeah, we will get some next week. I think it's the 15th. I think it's the date that it's arrived. We had a mock trial yesterday. My understanding, everything went well on the execution of the delivery. We've said that that first batch, around 1,950 doses, will arrive. They'll be distributed, or they'll be delivered here in Halifax. And it'll be frontline healthcare workers will be the first group, and then before the end of the year, before the end of the month, we'll get a better sense on how many vaccines we will be able to get, really almost weekly, here to the province.
Follow up. Do you know how the distribution will look like? Will it need to be a central location that people will have to go to get their vaccines, seeing as how it needs frozen, a deep freeze to keep it stable, or would it be distributed to various health centers?
Well, right now that's why we're delivering it here next to our tertiary care center. We have the freezers there. And people will come to that location to be able to be given the vaccine. When we start, and really the first doses that come, and it will be our trial run, really, with the real product. Once that product comes, we have other freezers that we can use. And there are other vaccines that are in the works. They're not approved by Health Canada. Some are before Health Canada now, which require different ways of storing it. So when we start receiving that vaccine, we'll obviously deliver it differently based on what the advice we are getting from the manufacturer of that particular vaccine.
Lindsay Armstrong with All Nova Scotia. Lindsay, go ahead.
Thank you. Premier, you've spoken about potential targeted funding areas from the feds. You mentioned long-term care and pharmacare. What do you see as the highest priority area for Nova Scotia that really needs this additional support?
Well, obviously, delivering the cost of drugs are escalating across this country to deliver health care. That's an important one. The National Pharmacare Program, I've said before, I believe is the next phase of how we deliver a universal healthcare system in this country. Mental health investments was part of our first wave, important part to target those deliveries. There are many aspects where they can help improve the outcomes that we're looking for. I want to get to the day, I hope a future government can get to the day when the national government is a larger contributor to actually dealing with the current system. Primary care and provincial governments can really focus on prevention, identifying ways of keeping our citizens healthy, and by then helping to reduce the costs on our system.
Go ahead, Lindsay.
Thank you. Moving on towards vaccines, can you tell us about the private procurement process for these ultra-cold freezers? Have any been officially secured, and can you tell us where they come from?
I don't have all those details. I can get those for you, though. But as I said to you before, I've said many times, we put together a team around procurement. It was led by Fred Crooks, our deputy in regulatory reform, across government. So all of that procurement would take place out of that team. And as I said before, the current freezer that will be used is already in our system. There's some others that have been offered for us to use, and now we're looking at where would we need to locate one, simply because geographically there isn't one there now.
Next we have Jennifer Henderson from the Halifax Examiner. Go ahead, Jennifer. Jennifer, are you on the line? Okay, we'll move on to Alexander Kwan with the Global.
Thank you. Premier, you mentioned that there was conversations on that the federal government would be covering the costs of the vaccine, but obviously the province would be covering the costs of distributing it. Is there any sense of what that might look like or how much that might cost the province?
We don't have a sense of that right now. As you know, the people who would be delivering it are people who are currently employed with us now. People who would be injecting into your arms are people who we currently have employed. It's really using our network of facilities across the province to be able to execute the delivery of that vaccine into Nova Scotians.
Go ahead with your follow-up, Alexander.
Thank you. So obviously the conversations today, you mentioned obviously funding isn't a conversation that started when the pandemic began, but I wonder, I guess the priorities from what you view as priorities of funding for the province of Nova Scotia change because of the pandemic?
I think across the country, you looked at long-term care. How do we continue to invest in long-term care, vulnerable population, to ensure that whether it's this virus or future ones, how do you ensure that you protect some of the most vulnerable citizens in a province? I think if you look and an ongoing discussion is what is the appropriate size of a long-term care facility. If you go back and look in just historically in Nova Scotia through successive governments of all political stripes, the way we build these facilities has changed. We now obviously still have some older facilities, but there were criteria and models that were being used in our province where we had pods and wings where people were being separated, individual kitchens and dining rooms, separate spaces, washrooms. That path had already been ongoing for, like I said, through all three political parties. And I think when you look at that, our long-term care system is certainly going to require capital investment. We have facilities that, more than two people are sharing a washroom. We have, in some places, we have 3 to 4 people. And, obviously that, because of the pandemic, needs to become a priority in the coming months and years to be able to make sure we're keeping them safe.
Okay, we'll do another check for Jennifer. We'll just hold on for one moment. Okay. Premier will be back tomorrow for the briefing with Dr. Strang. Thank you all.